Hello guys, welcome to SGOC conference. Today's I will explain that the rotator cuff repair surgery, okay, specialized evolving technique. So there is a lot of the shoulder problem patient. So for study, I visited a lot of the famous doctors. I met the very famous doctors in the worldwide, especially in specialists in United States, John Won and Sugaya in the Japan, and also Teru Miyata in Osaka, and we met in Jonathan Barlow, Mayo Clinic professor, and also I locally visited to the AOS conference last year, and so many. We also met Bassem El Hassan, who is the MGH professor. So there's a lot of the idea, the treatment protocol about the shoulder, especially in the rotator cuff tear. So first of all, we have to understand what is the cuff tear, what is the shoulder problem. We have to divide. Before that, we have to categorize, divide the two groups of the patient. The left group is they look, as you see that they are crazy at the sport, very heavy sports players. But as you see the right side, this is unusual people, okay? So a lot of the people they have their lifestyle will be similar like the right side, right? So left people getting be hurt their shoulder under extremity very hardly, okay, with a high rubber sport because of the high rubber injury. But right side people, as you see that they don't have they don't have a lot of the muscle, that they are not a muscular people, so they are have some problems. If they are getting older, they will have some degeneration problem, okay? So we have to understand differently with the groups. I love the running, I love the marathon, so there's nowadays many Korean people, so they are learning, they are crazy at learning. But when I run the marathon, half marathon, and this is my first time after the marathon, I have a lot of the pain in the knee joint, right? So for understand about the deeply a lot of the sports player, before that we have to play the same level of the sports. Then doctor could after that doctor could understand more deeply of their condition and the state and the injury mechanism, okay? So as I talked to you, there's two groups, right? Low demand, the high demand people of the health and sports. But in every worldwide, many people work out so much more than before, I think. So hardly they push themselves so harder than before. So I think as I divide the two groups, but I think the low demand and high demand is close than before. So as you see that 83 years old grandfather is his looks so good, so cool, right? So, and, like that. So, really speaking, the people consider about the much more healthier life, right? They push themselves so much more than before, right? So, because of that, we doctors, especially in orthopedic doctor, have to think about much more detail about their condition, muscular condition, and tendinous condition, and ligamentous problem. Okay, so our body is covered with a lot of the muscle and tendon ligaments. So with that, we can compensate the stress of the burden of our joint. So with a lot of the muscle, we could reduce the stress onto the every joint, right? So for prohibit the arthritic change or joint problem, we have to work out, exercise, super hard. So do you like exercise?
Yeah, I like yoga. I don't know like running. I like yoga, yes.
So
I like walking.
okay, great. So every people needed an adequate volume of the muscle. So if they don't after depletion of the muscle, we call that sarcopenia. That could bring another problem of your joint problem. Okay. So we want to talk about the shoulder problem. Okay. So anyway, before that, the health or joint specialist, the concept is shifting from the trauma to the nowadays. Many orthopedic doctors study about that degeneration, how to keep the function much better, because there's a lot of the sports people than before. So we have to how to get their healthcare problem. I always worry about we could fix them and how to get change to his condition to the normal more faster than before. We go to the return to play. So we always focus on that. The first faster rehab, faster return, high demand exercise, higher tension ligament and tendon for prevent the damage. We have to prepare for ourselves. Okay, faster operation, faster rehab. Then we can prepare for the high demand exercise. I went to the Mayo Clinic to study about a lot of the hard case of the surgery and the hard case of the case, and also I'm very interested in how to do the sports rehab in their clinic. As you know that Mayo Clinic is most famous hospital in the world, right? There also is a very crazy to the rehab system. Okay. So we visit with my friend, and their target to getting better of their patient is their target is so high. So they push them, and the target of the performance is so higher than I expected. So and this every very huge building is the building is for the rehab. So every single patient, they could be recovered 100 or 200%, I think. So as we know that there's a lot of the stage of the recovery. Okay, first of all, after surgery or after injury, doctors consider about their patient state. That the first step is that recover from the inflammation and the pain. A second step is recover of the range of motion, and third step is recover of the muscular function. And the first step is muscular recovery of the muscular endurance. And the fifth step is recovery of the proprioception and the function and the balance. On the sixth step is recovery of the functional exercise and the plyometric exercise. And seventh is that recovery of the cardiovascular exercise. Last is that recover to the normal life, okay? So return to play is the most important and the very most important key word nowadays in the orthopedic doctors and every hospital, okay? So we have to get back to the normal rise. We have to get back to the normalized faster than before, okay? And the more important thing is that we have to preventing from the damage of our tissue and our body, okay? We have to the prevention is the most important. We have to remember that. So let's talk about the shoulder, okay? Today's topic, our topic is that the rotator cuff, okay? So rotator cuff is consists of that 4 tendons. The most anterior side is subscapularis tendon is located in here, and supraspinatus is located in the upperward, and infra is located in the backward, and the teres minus back and the lower part they consist of the rotator cuff. So these 4 tendon coupled with the humeral head. With that, the humeral head could be stabilized, okay? So we call that, doctors call that the footprint. And that means that attached side of the rotator cuff. So with that tendon, as you see that this is a humeral head. Every tendon is covered, every humeral head. With that, we can rotate our arm very functionally, okay? External rotation, and this way is internal rotation. We can easily further elevation, or we can easily abduction. The kind of the exercise could be motion could be possible with that muscle or tendon, okay? But as we see that the leading edge, we call that, and the most common of the problem site is always from the great tubercle, GT, we call that. From that, the tendon, especially supraspinatus tendon, could be easily damaged and torn from this point, okay? So if that happened, that tear, the site could be bigger, much bigger than before, very easily, in those very short time, okay? So that is a problem. So that is the main issue of the rotator cuff tear, right? So if you have some problem, if you have some muscular weakness, a doctor worry about your tendon state, okay? As we see that there's a lot of the color covered with the granular, the humeral head. This is a full footprint of the rotator cuff tendon, okay? So in this way, this is subscap and supra, infra, teres minus. So in this anterior side or posterior side, the tendon tear could be happened in the one direction. So most usual way is from the anterior side to the posterior side. This pattern is most usual, but sometimes the tear site is from the back posterior side and to the anterior side. Sometimes it could be happen also. So many doctors study about the tear state with the MRI. So we divide a lot of the tear pattern. The first, not full thickness tear. That means that, as you see, that the tendon is connected, not a fully retracted state, right? This is connected in your glenoid humor. This is not yet fully detached, okay? It is attached in the humeral head, but as you see that the tendon state is not good. It's not normal, right? This is abnormal state. We defined this state as a partial tear of the rotator cuff, okay? So there's a lot of the papers about how do we have to manage the partial tear. So Airman doctors classify the partial rotator cuff tear as like that. So there's three types of type A, type B, type C, and they divide the grade 1 to 3, right? With the severity, okay? So nowadays, a lot of the doctors have to make a consensus of the treatment protocol, okay? If the patient have the partial tear of the rotator cuff more than the 50%, then we have to consider if the patient have symptom is not reduced, and also the patient have the partial tear more than the 50%, we have to consider about the fix it. That means a surgery, okay? So we divide that the area of the cuff tear. So inner side or outer side, we have to divide that first. Intraarticular, we call that. If the patient have some problem with the intraarticular point, doctors recommended surgery and fix with the ankle like that, and tightening with the fiber wire, okay, with the anchor and the fiber wire. As you see that the right side, after surgery, the tendon could be fixed very firmly, okay? So in this way, we can preventing additional problem, additional tear site, okay? Also, we have to consider about the bursa tear. That means the outer side. As you see that this is a bursa tear, right? In outer side tear, even in more than the 25 or 30%, that means a degeneration state, okay? So doctors will consider the fix also, even though they have only 25% problem. So that means doctors consider their future, okay? So many doctors worry about that the state is not just because of the trauma, but because of the a lot of degeneration or inflammation state. So we have to fix that. We don't expect the good results, so we decide to fix that, okay, with the same way, okay. So there's a lot of paper studies about this partial tear, right? So anyway, as I talked to you, and this is the protocol nowadays, the main protocol for treatment of the partial tear. Next thing is how do we fix that? How do we treat the full thickness of the tears? Full thickness means that it is already retracted, detached from the GT, right? Granted tubercle. So that means you have to surgery, okay? That's the first key word. And we categorize the amount of the defect, okay? Under the 1 centimeter, we define that small tear. Between 1 or 3 centimeter, we define the medium tear. But after more than the 3 centimeter, we define the large tear, and 5 centimeter, more than 5 centimeter, we define that the massive tear. So, what should we do? We have to fix with that this retracted tendon with the same way. But we have to more consider we have to more firmly fix with that anchor. Not only the single row, but also we have to. I think a double row is a much more efficient way to prevent to the retear. Okay, it could reduce the retear rate. Right? So we have to focus on that. Accurate of the diagnosis is the most important. Okay.
Yes.
So as we see that there's a lot that after the cup tear, we can fix it like that. As we see that, it looks very firm, right? Yeah. So we don't worry about that the dysfunction of the cuff anymore after surgery. Nowadays we can additional option treatment option called that the only collagen patch. Okay, so especially Smith Nephew company invent this product called that Regenten. Okay, some patients have the tendon is already very damaged, so their tendon is very thin than before. That means after we repair it, because we retracted the tendon to the normal side, that means it could bring a much more narrowed state. Okay, so for prevent the retear, we can think about the collagen patch like that. That is a good option for firmly fixed. Okay, it can reduce the retear rate. Okay, so let's see that the arthroscopic video. As you see that this is a humeral head and this is a rotator cuff tendon, spur spinatus. So we can shaver and we can reduce the compression. We call the decompression the procedure, and burstectomy. We can reduce the inflammation. After that, we can fix the rotator cuff like that. So this, in that way, we can fix that anchor to the greater tubercle, and we can passing to every the fiber wire in the inner side of the rotator cuff tendon. This is rotator cuff tendon, and we also fix it with that ankle, lateral side ankle like that. We cover every the humeral head. With that procedure, the rotator cuff tendon could be firmly fixed in the normal side. And after that, because of the tendon quality is poor, so we can consider additional option. The Regenten is a very great option for preventing retear. Okay. So, but we also, our second topic is that the massive tear. As you know, as you see that this is that in this tear pattern could much more easily fixed with the arthroscopic procedure. But as you see that this massive tear is a little bit terrible. Okay. This massive tear is not a same rotator cuff tendon. It's not a normal disease. It's like a beast. Okay, very very stressful disease, right? Yes. For the patient, right? So let's expect about that. Let's think about this two kind of patient who has only the small tear, but like the right side, he cannot follow elevation. Yeah. His arm is not moving to the above. Okay, so upwards. So what happened to him? When the cuff tear is so severe, that could bring some kind of the rotator cuff arthropathy. That could bring some kind of the arthritic change. So many doctors were worried about. Many shoulder specialists always fix that rotator cuff repair. The most important reason is that we don't want to make the patient to the change to the massive tear, right? that is a very yellow sign. Okay, we worry about their massive tear. So if they have some problem like a massive tear, so we have to. There is a lot of the treatment protocol like that. So nowadays, many doctors think about many protocol. That means that it is very hard to fix it. Okay, it is very hard to treatment. Okay, there's a lot of the option, SCR or reverse total shoulder, partial repair, early transfer. As we see that left side looks normal, but after massive tear, the humeral head move upward like that. So we call that there is arthritic change. They bring some kind of arthritic change. Okay, so with that, the acromion and the granular humeral joint is changed to the degenerated way. Okay. So we divide like that, like that, arthritic change, arthritic problem after the massive tears. The main problem is that some kind of patient cannot move their arm to the upward. Okay, we call that pseudo paralysis. Okay, so the muscle is not paralyzed, but because of his tendon problem, they cannot move his arm to the upward. Okay, they do like that in that way. They cannot forward and they cannot make their arm to the upward. Okay, so they use like that. They use move like that. Okay, so this is a very big problem. Okay. They cannot wash his head. They cannot drink any coffee. Very usual performance is not affordable for them. So first, if the patient is severe massive tear problem, arthritic problem, combined with the arthritic problem. Many doctors should consider what reverse total shoulder arthroplasty. But it is good treatment option, but this is the complication of the reduce the range of the motion, especially in the rotation. After surgery, this surgery is a very great option, but it could bring their arms very much easier than before surgery, pre-OP, but the range of motion, especially in rotation, is very prohibited. Okay, but it's not restricted. Okay, so we can many doctors study about another option. Okay, because what is much more treatment protocol? Every doctor, me also. I also think about how could they treat much more most profitable, most efficient way to treat the massive cup tear patient. Okay. There's a lot of the things, the factor that as we see that there's a lot of the factor if affect to the repair of the rotator cuff tendon after surgery. Okay, so the age and the infraspinal tooth, the fat infiltration, and the size of the tear, and the bone marrow density, and the high level of the occupation,
Activity.
Activity, high level of the activity. That kind of the factor could affect to the rotator rate of the rotator cuff tendon after surgery. Okay, so if that patient have the problem, but if fixable, first we can fix the cuff with the partial tear with the patch. The JCU, which is my mentor of the Samsung Medical Center, published the study, and he's fixed with like that way, the partial way, fix that, and coupled with the patch, thermal patch. With that, the cuff could firmly fix in the right way. So, as with that, this kind of the massive tear could be fixed with that partial repair also. So, as we said, this is thermal patch. We can fix that, couple with that defect site. Okay. So, I think this is the first option we have to consider about that. This way is the most not so invasive way. Okay, we can fix that. If this way is successful, it is a very good option, most great option to the patient. I think. But if there is a tendon deficiency, so much more than our expect, and we cannot consider the partial repair. We have to consider another some kind of the allograft or some kind of another graft things could be needed. Okay, scaffold could be needed. So pteromiata is invented to the supracapsular reconstruction. Okay, SCR with that tensor fascia lata, tendon, and also biceps rerouting could be a great option. Also, another advancement could be a great option also. So, Bassam, Hassan invented the lower trapezius transfer. With that, we can getting better, and we can the functional recovery could be affordable after surgery. So when I met Termiata in the Osaka University Hospital, he invented it in this way. I think this is also great option to cover the massive tendon tear. So as you say that he harvested that tendon from the tensor fascia lata and the side. They forward with like this way. As with that, the depth is so much more than 9 millimeter. This kind of the tendon, if that tendon covered the defect site, it will be a great option to treatment of the massive tear. So as we see that, the tendon is he fixed with the defect side. Okay, so now the Beata is not only use this tendon graft to the massive tear, he also used that tendon graft to the rotator also. So in that way, the patient tendon could recover and strongly, much more stronger state could be after surgery. So there's a lot of the paper about that. So but the procedure, it takes a lot of times, and the people is the technique is so hard. So nowadays some doctors discovered another procedure way. So, but when I'm visit to the Mayo Clinic, when I'm with the general bowel teams, he also agreed with that SCR technique with the allograft. So he also is we talk about that massive tear repair. That because this is a main issue of the shoulder problem, especially in rotator cuff tendon tear. So he also usually used the allograft to the SCR state procedure. So with that way, that the glenoid and glenoid humeral joint could covered much more efficiently. Okay, and next treatment option is advancement procedure. Okay. Ashi Gupta, who is a doctor of the Australia, he invented in this operating procedure. He cut from the supra or infraspinatus of the muscular attach site, origin site. With that dissection, that the muscular could be retracted much more easier to the lateral sides. So with that way, some massive tendon tear could be fixed much more easier than before. So nowadays, in Japan, many doctors also use this way. Okay, so we met Dr. Sugaya in the Tokyo 2 years before. So he also preferred this way. He's who is the president of the shoulder department in the Japan. Okay, so he also agree about that advancement. Okay, this is advancement surgery procedure.
In Japan.
Yes. He cut the origin site of the supra and the infraspinatus with the arthroscopy. So first step, detach from the origin state, origin site, and he retracted to the lateral side and fix it like that. Okay, so this is after detachment from the origin, and he fixed that the cuff in the right side. It's much easier than SCR procedure, I think. So the last thing is the LTT, lower trapezius transport. The Dr. Bassam El Hassan invented in the procedure. Okay, he invented because of a lot of the who have some problem with the large defect of the cuff tendon. He cut the trapezius, lower trapezius tendon, and with that some kind of the allograft tendon or autograft tendon, he extension. With that tendon, he extension of the lower trapezius connected. He connected to the lower trapezius tendon with that allo or autograft of the U tendon. And after that, he fixed to the right side of the humeral joint. So we call that the lower trapezius transport of the massive irreparable posterior spiral rotator cuff tendon tear. So with this procedure, we can expand. The idea, new technique, new idea. His idea is a very sensation. I think so because he's a very special. He's a very specialist about that scapular abnormal motion. He understands very deeply about that scapular balance or some kind of that muscular balance proprioception. He also studied a lot of the paper. He published a lot of the papers. So I think there's a lot of the there could be a lot of the new technique to fix that massive cup tear tendon like this. So the summary is that if there is a problem in the supra or infra, or we can, especially in the massive cup tendon tear, we can consider about the SCR or advancement. But if there is much more than 2 tendon, it involves more than the 3 tendon, we have to consider about the lower trapezius transport. But this tendon involves the subscap tear also, a massive tear, and if the shoulder joint is changed to the arthritic change, we have to consider about the reverse total shoulder arthroplasty. Okay, so that's what I want to talk about rotator cuff tendon. The most important thing is that every idea and every treatment protocol could be different from now than before. Okay, so every new technique could be challenging for better treatment option. So we have to study and we have to discuss about a lot of cases, patient case like this. Our team is connected with our most famous hospital, most very great doctors in the world. So in this way, we can deeply discuss with we could deeply discuss with others, the patient, the problem and their state with a lot of doctors. So in this way, we can pick up the best treatment option, and in this way, we can get to the most healthier state than before. I hope that. So thank you for enjoying our conference. I hope to, if you have any question, if you give me any your problem, please reply over your state to the YouTube channel. Thank you.